Hi everyone, this is Abdul Fattah Ibrahim. I'm the head of communications, campaigns and advocacy at MSIF. I'm recording this video to just talk you through the new section that we've created on MSIF website. That's particularly dedicated to access to healthcare. And this is just an opportunity to just run through the information available there, resources and tools, so you kind of get familiarized with the new section. Hopefully, you can find it useful if you are an MS organization, healthcare professional, or an activist from the MS community and willing to kind of take actions and start to act on relation to access to treatment. That could be a good place to start with. Um, just to make everything easy, I'll share my screen. So as you can see, as when you arrive to MSIF website, this is the section that was created recently. It's access and advocacy, and it has a drop down list of key sections. If you click through the main tab, this is where it takes you to access to MS healthcare, and it has taken into account the user journey, if you like. So when you come through this page, then you click through one section. How would you move from one section to another, and kind of sort of building your knowledge and also finding relevant answers to your question, as well as the resources that could help you. Um, if we look at this, there is improved MS diagnosis, improved access to treatment. That's just an overall. And then we have here, learn from others, get the evidence, how to get started in advocacy. This is some of MSIF work on access to MS healthcare. And this is stories from people with MS. And then at the bottom, there are other relevant information in relation to access to healthcare generally. So just to give you an idea what each of these look like, when we go to improve MS diagnosis section, this is where you find information about diagnosis. So from what needs to be done, so basically identifying the global challenges in relation to MS diagnosis, and kind of also recommendation in relation to MS diagnosis. So MSI believe that each country should have a national plan or guidelines for the healthcare of people with MS, and it's also have a clear recommendation on or belief at least from MSIF side and what overall should be done. But obviously, every country is different. Context might slightly change, but that's is more like a guidance. And here we draw on the information available from the Atlas of MS in relation to diagnosis. So it's sort of evidence that kind of show the current situation in relation to access to diagnosis around the world. And once the issue has been established, if you like, then this is where we kind of start to think of what can I do to help. So this is where we briefly talk about the need for evidence, get the evidence section, which is I showed to you earlier on the main landing page of access section. And here is just a summary on where you could get information in relation to get the evidence, but I'll get to the get the evidence section later. But this just to give you an idea, when you visit that section, you can kind of go from one part to another and build up the knowledge and actions as you go through. Get help as advocacy. That's where it takes you to the what advocacy is and how you get started. And again, I'll show you this section. This is where there is some tools available there that you can adapt and use for your own context. And there we have also here learn from others, and that's again it's the main section on the on the access to healthcare landing web page, and this is very much about MS organization sharing case studies from MS organization from different parts of the world. So going back here again, moving from improve MS diagnosis to improve access to treatment, to MS treatment. This is again, it has that similar flow of information of what needs to be done. And here in this section, unequal access to MS treatment, this is where we talk about the draw data from Atlas, where we talk about the challenges in relation to access to MS treatment around the world. So there are some key data in here that you can make use of them, and to complement what do you have on the national level. Actions, what can be done. Again, same format of the previous page of diagnosis, get the evidence, get helpers advocacy. There's also some sections here to talk about off-label treatments for in countries where off-label can be readily available and affordable and can be as a use. So what sort of evidence are there for usage of label? And this link would take you to get some of the guidelines and information about off-label treatment. This part talking about essential medicines for MS and email. And again, that take you to some of the work that we've done on relation to email. This is the WHO 10-year plan to improve healthcare for neurological condition. That's another tool available that WHO have produced, and you can look and see whether this is something that you can make use of it as an advocacy tool, and learn from others. And here we elaborate a little bit more. So we kind of included some case studies in relation to access to health to treatment from Serbia, Egypt, Thailand, India, Malaysia, and they are video recording, so it's quite interactive, so you can see what has been happening and perhaps compare and relate what situation in your country is like. So once you've sort of read about just get an idea about access to MS treatment challenges, and you kind of start to think, okay, I kind of now maybe need to know more about get as evidence, what evidence I need to enable me to go about and start to actually advocate for improved access to treatment in my country. And this is where this section will come handy. In this section, we again refer to the Atlas of MS as it's the most comprehensive worldwide study in relation to epidemiology of MS, but also it does have some clinical management information in relation to access to treatment or lack of it. Same for diagnosis. So it's really useful platform where you can access some information about your country, but also you could use that to get information about what's going on and what the situation is like in neighboring countries. This information could be really useful, so you can demonstrate to decision makers that the neighboring countries or countries that has a similar socioeconomic condition, similar socioeconomic level, that they actually maybe have a better access to neurologist or treatments, and this is where you can sort of use that to demonstrate that there is a potential for the situation to actually a potential solution for your country too. You could even identify neighbor countries where the situation is slightly better and get in touch with them and get to understand how did they reach to the situation, what did they do. So it's kind of it's very useful tool to explore what's going on around the world, around in the region where you're from, and perhaps start to use this information to build up your case or your evidence to advocate for better access to healthcare. In this section, there is information about how can you use Atlas. I'm not gonna go into this, but when you read that on your own time, you can, yeah, you can find the how can you download the Atlas, that you'll be able to actually download a profile of a country profile where it has a key information um, about MS in your country. And we've also included some of the um, examples of how the the usage of Atlas data has been, used by other countries to enable some of the work they are doing. But on this one, before that, you will find here a video talking about how can you use the Atlas website and the toolkit. So that will just make things much easier for you. Uh, Um, and then the information, as I said, about Atlas is a very powerful advocacy tool that we know of. Many countries have used it to build up their evidence. If you need any information, feel free to reach out to us on this email address, access@msif.org. But there is also, you'll find here, how can you use Atlas to advocate for improved access to healthcare, MS healthcare in your country on this video. There has been also some examples here from India, from Ireland, on how did they kind of the Atlas has inspired some of the work they've done in relation to advocacy and campaigning. So we have Numbers Matters campaign. We have in MS Ireland as well. There is some of the work around Atlas. There is, in addition to that, there is other examples of how MS organization have went about trying to improve data available and evidence, because every time you go and try to advocate, data could come could be a barrier, and that's just different examples with different models actually. So it can be really useful that you can look at all these examples and models and just understand which one of them could be more relevant to your organization capacity, to the skills and experts that you have within your organization. Some of these is about coordinating data collection. Others is about actually you are advocating for improved for registry for MS, like Numbers Matter campaign, or improve the methodology of collecting the registry. So you kind of advocating for it opposed to you doing it as MS organization. So there's different models and that you can see and learn and perhaps adapt from them as well. So this is the evidence. This is what you sort of need to have in place in order to help you identify the issues you're having and being able to actually use it in your advocacy work. Then we go to this section is how to get started with advocacy, and in this section, I think it would be very useful for organizations, healthcare professionals, and individuals with MS or activists from the MS community who haven't done advocacy work in the past. Because in this section, you'll find information starting with what is advocacy, starting with the basics, basically, and just trying to get that a firm understanding. If you are a team of people, each of you could have a different understanding of what we mean by advocacy. So it's good to kind of come together and just agree on this is what we think advocacy should do. This is what advocacy we mean by advocacy. I think these sort of definitions sometimes is actually very useful to have a common understanding of them within the team. In this part, there is advocacy basics. That's an article my colleague Nick have written about what is the basics of advocacy. And this is a video I've recorded, I think, last year. Again, it's about the main blocks of the advocacy. So there are, 8 main steps that you, as an organization or individually, can take and follow through to be able to deliver on an advocacy project or campaign. And these just to as a starter, if you like. And then there is using advocacy toolkits. There are out there. There are really good advocacy toolkits from within the civil society sector. Some of them are on health related conditions, but others are not necessarily so, like the Plan International toolkit. They're very detailed. So, and it's one, step-by-step toolkit. So this is a Plan International one, for example. It divides any advocacy work into three main sections: understand it, plan it, and do it. And under each, there is steps that you need to take. For example, in understand it, this is where you start to identify the issue that you want to address, who I need to speak to, and to engage around the issue. Carrying out your research, how would you do it? How do you collect evidence? Is it through surveys, interviews, other ways? Similarly with the plan it, again, the message you want to do, how we're going to manage the risk, which is something very important to consider when you embark in any advocacy work, and how, doing it actually, the campaigning tactics, mobilizing support, making use of the media and other communication channels. So this is a long, very detailed toolkit that you can have a look at and start to kind of take that and take these steps and put them into practice and kind of build up your advocacy work as you go forward. And again, there are many others available online for free, but these are a couple that we came across and found quite useful. And when we talk about advocacy, there are some key components of MS advocacy work. There is evidence. We talked about it earlier. There is a whole section about get the evidence. Again, that's where you can click and takes you to this section. But equally, storytelling is very important. It's a very powerful advocacy tool. It really, as some people say, evidence speaks to the mind, stories speak to the heart. I agree with that, but I would add to this as well. Stories do speak both to the heart and mind, because it does actually show decision maker what is life with MS, how their decision will impact people with MS life, and what does it mean? All these numbers and figures that we draw in from an evidence or a research, what does it actually mean on the ground for people with MS? So it does have that very strong powerful advocacy influence or advocacy impact, if you like. We do have here examples of stories. I'll click here, and again, they are in the main section. So if you go to this section is getting the healthcare I need. That's what we call it. This is the stories we've collected from mostly from Malaysia and Morocco, was one that was collected remotely from Argentina. In each of these stories, they are all of them very much focused on access to healthcare, but again depends on what the issue you're trying to address. That you perhaps you need to have one relevant story, one story. If you're trying to talk about the lack of number of neurologists, that's where you're trying to find a story that kind of convey that message and show the impact of not having enough neurologists in the country. But when you go through these stories, you get a sense of how each individual have sort of experienced challenges in relation to access to health care, how it impact their life, how they try to navigate the solution out of the situation, and it kind of have that strong message as well, as in, there is a challenge that need to be addressed. Some of these stories are written in a first person narrative. So as someone is speaking and telling their story, others has been with in a more of a third or a mixture of third and first person. So it's someone introducing the story, and then there is a quote from the individual. You can use any style that you think will appeal better to your audience. some of these have videos, others have only images, but images is very powerful, it's so important, and it just shows, again, it connects that impact with one person, with the individual with MS, and it put people with MS as the heart of what you're doing. That could be for some organization trying to collect a story can be expensive or quite beyond their capacity. I would say I wouldn't you don't necessarily need to create many stories. You don't necessarily need to, ideally, yes, you want to have that great quality, but if you can't, perhaps you can uh, go out and try to see if there is a good story that you can make use of it, and then start to think about how can we collect it, and there is imagery that we could use. Or even perhaps not, if you can't do that, you just make sure people with MS are with you in the advocacy work. If you go to the session making, speaking with them, having a person with MS going with you, speaking about their individual experience, and just having, sharing their story there and then could be a good way that you can making sure voices of people with MS is included, or is an integral part of your advocacy work. Um, Going back to the how to get advocacy, or how to get started with advocacy, there is that section. It's about examples from the global MS movement, and if you press here, it takes you to learn from others, which is again on the main part, so which is here. And in this section, we kind of divided them based on the way that's the approach that some of our members and other MS organizations have taken to advocate for certain issues. So from key facts document on how this helped MS Australia in their work, to using a petition again, in Canada, for example, they've used petition open letter for change in relation to access to healthcare. In the United States, they've kind of built up a network of MS activists. And in Australia, how you can make most use of the policy consultations. And then we have other examples in the usage of the rule of the national essential medicine list in the country, and how can you actually capitalize on the recent decision by the WHO to include MS treatments to the essential medicine list. How can you take that forward and kind of take that to the national level and make most use of that? So we have video case studies from Malaysia, India, Thailand. And we will be developing this and adding more case studies. And please do feel free to email us any example of work that you've done in relation to advocacy or improving access to healthcare. I'll go back to the main section. This is people that share their story. This is the healthcare I need section, the stories that I've run through it with you earlier. And here it's includes some information about MSIF work on access to MS healthcare. So what we've done on our work on global level, also the essential medicines for MS and what we've done so far. Off-label treatment for MS, and information about guidelines available about how off-label treatments are being used, and also some example from our regional and national work and case studies that you can find more about it here. In this additional information, you'll find what is called IGAP, which is an intersectoral global action plan for epilepsy and neurological disorder. That's the 10-year plan that WHO have developed, and it's an advocacy tool that you can again tab on and see whether you can adapt and make use of that within your advocacy agenda. This is information about essential medicine list. This is information about off-label treatments. that contact us for advice. This is where you can, if you want some advice and support, if you're considering using the email in your advocacy work or other things, or you have an idea, you want to bounce it with someone, please do feel free to reach out to us, and we'll be more than happy to provide any advice and support, and be a good peer to listen and reflect with you. And that section has all relevant publications, so all publications on essential medicine lists, on off-label, and barriers to access to treatment, barriers to diagnosis, and more. So I think this is very much it. This is a work in progress, so we will be developing and populating more information and resources and tools as we go forward. If you have any useful information, tools, case studies, work that you've done in the past, please do reach out to us. access@msif.org, and we'll be more than happy to discuss it with you. If you need an advice and support, again, just reach out to us, and we can see what we can do and what we can share in terms of advice. And yes, I really look forward to hear from you. If you have a feedback as well, how to improve it, and how can we, what sort of information that and resources that you need to see, again, reach out to us. And I really look forward to hear about the great advocacy work that you have undertaken already, or are planning to embark on in the future. Thank you very much for your time and for listening.